And insulin is my whole body communicator hormone. It is the one that helps the brain talk to every single other hormone in the system. So if insulin isn't in the correct range, none of those other hormones are going to be either. And that's why blood sugar is one of the first things that we really work on with a lot of patients, because once we can get it regulated, that's a giant step right there.
Welcome to the Erie Wellness Podcast. I'm your host, Lauren Brunetti. Each week, I sit down with local doctors, therapists, wellness professionals, and community voices to have thoughtful, real conversations about what it actually means to feel better. This podcast was created because wellness can feel overwhelming. My goal is to help cut through that noise by highlighting trusted resources right here in our community and having conversations that feel approachable, honest, and grounded in real life. Whether you're navigating a season of change, looking for support, or simply curious about what's available to you locally, this is your space to learn, reflect, and feel supported. Because when you start to feel better, you start showing up in all areas of your life, and you deserve that. I'm really glad you're here. Let's get into today's conversation. Today, I'm joined by Dr. Samantha Boldt, founder of Live Your Life Integrated Health and Chiropractic. And I have to say, Dr. Boldt, it's been so fun to watch your practice grow and evolve since opening your doors in 2018. Your passion for functional medicine began after your own struggle with Lyme disease, spending years searching for answers before finally finding the root cause and beginning to heal. So now her mission is to help others get answers sooner. Today, we're diving into 3 key areas of functional medicine testing: CGMs, or continuous glucose monitors, Dutch hormone testing, and food sensitivity panels. What they are, who they're for, and how they can help you better understand your body. So let's dive into today's discussion. Welcome, Dr. Boldt.
Hello, thank you so much for having me on here. I'm very excited to be here and talk about what functional medicine is and some of the different tests we use to really get patients, more of their in-depth answers of what their body is doing at a cellular level.
Yes, I'm very excited to learn from you today. Dr. Sam, your journey into functional medicine started with your own 3-year journey and struggle with getting diagnosed with Lyme disease. How did that experience shape the way you approach your patients today?
Great question. And first of all, if you don't mind, I'd love to explain just a little bit about what is functional medicine.
Yeah, that would be great.
I think it's hard to answer some of that without knowing a little bit more of that piece there.
Mhm.
And functional medicine wasn't actually something I was super aware of either until I started having my major Lyme disease and was 3+ years into this. But what functional medicine really is about 30 years ago, actually, a group of medical doctors got together because they were tired of having minimal time with patients, being rushed through appointments, and really feeling like the only treatment options available were medications to help manage symptoms, not even necessarily treat what was going on, but to help manage a patient's symptoms. So they said, let's take a step back. What can we do to really understand our patients better? How can we treat them other than just always looking at symptoms, always just looking at medications? There's got to be a better way to do all of this. And that's really where functional medicine formed. And so now today, functional medicine's kind of evolved into being able to spend more time with patients, digging in deeper into their personal health history, their lifestyle, answering all these questions so we really get a full big picture of what they're coming to us with, and making sure we're keeping up accountability wise with them and what are they actually doing in between visits that's affecting their health. And not only that, but how can we do a better job at looking more in depth when it comes to different types of labs, and treatment wise, does it always have to be medication? Can we work a more natural way, thinking more along the lines of food, diet, lifestyle, supplements? And so that's really that whole kind of bigger picture of functional medicine, to say, how do we get this body really healthy so that, even though we can fix your problem you're coming in with right now, we really want to also make you more resilient to all of life moving forward, right? We want you to have this nice, long, wonderful life into your 70s, 80s, 90s, 100s, and feeling good and having that whole wonderful time frame there. So that's what functional medicine is. And with Lyme disease, I was in my young 20s when my body just started failing me. I had depression, I had anxiety, I had extreme nerve pain. I was getting to the point I couldn't eat. I was losing a bunch of weight. This all happened over the course of about 2 years before we started to really try to find answers. And I'd been to a few doctors and they had just been like, no, we can't find anything wrong. It's all in your head. We think you're just stressed or anxious, rest more, have some anti-anxiety medication. And I was like, it doesn't feel like that. Something feels really wrong. And then I was fortunate enough to have my mom on this journey with me. We spent a year and a half. She dragged me everywhere. We went to almost 30 different specialists to start to try to get answers. And it was finally a chiropractor practicing functional medicine that tested me for Lyme disease and other tick diseases. I came up very positive. And she was able to send me off to a Lyme specialist that practices in that functional medicine realm. And finally, they were the ones I was like, okay, I'm finally having somebody that's listening to me, understanding me, and has some sort of plan in place. After a few weeks, I felt like I was in the right spot. And it took a few months before I really started noticing big differences. But in a few months, I was like, okay, body is finally starting to turn around. This shouldn't have taken 3+ years, 30+ doctors for someone to finally hear me, understand me, and take some knowledgeable action with that. So that's kind of changed my journey with patients. One, I do think it's made me a very empathetic doctor, for better or worse. I have been through almost every symptom that there is. And it's hard in your young 20s when your body is failing and you can't get out of bed for, months on end. These are supposed to be the times when your body's doing great, active, you're being able to get out there. And I felt that I had that whole emotional experience. It's helped me relate a lot more to patients and help them understand a little bit more what the journey is, what they put into it, what our role is in that, and where the Western, medical field has failed them a little bit more, where functional medicine is really stepping up and helping cover some of those places there.
Well, I love that you and your mom advocated for yourself and were like, this is not normal for a 20-year-old. Yes, she
Yep.
might. Were you probably in college?
Yes. Yeah. I was actually starting grad school. At college, I started having a few symptoms at the very end, and then starting grad school that year in was where it really started becoming more of an issue. So I'm sure stress definitely played a part in worsening some of that piece, right? But still, nonetheless. And I can never stress that enough for patients, is that advocacy for themselves and hope. I was like, do not lose hope. There's somebody out there that's going to be able to help you. It just might be a little bit of a journey before you get to that. And functional medicine is really trying to minimize how long that journey is, how many things have to happen before we get those answers, before we start seeing those differences.
Right. Well, unfortunately, society kind of normalizes. Like,
Yes.
we're all tired. We're all, all of these things. But,
Yep.
I don't want to be tired my whole entire life.
No.
And I want to feel good. And even in your 30s and 40s, like, you're in the prime, you're not
Right.
going downhill,
No, nope, not at all. I agree. So,
So, with that being said, a lot of listeners, they feel off, but they're told that their labs are normal. So, at a high level, what does functional testing allow you to see that standard blood work does miss sometimes?
yeah, and it is interesting to some extent because in a way, we actually use a lot of standard blood testing. We just are trained to look at it very differently. And that's probably one of the big differences with some of these lab tests. I love when patients bring me other labs that they've done by other doctors. Unfortunately, a lot of times they're told your labs look normal, there's nothing wrong. And there's very few patients that have brought labs to me that I've gone, oh, they're normal. Then there's 3 reasons for that. One is the current reference ranges. Reference ranges that we use for basically everywhere. I mean, LabCorp, Quest, all these different companies out there, they are using averages. So they're saying this is the average, adult in America, and this is the reference range we're getting from that. And anybody can go into that category as long as they don't have a major diagnosis. But that doesn't mean that people in that category don't have headaches sometimes, right? Don't feel fatigue, don't have some digestive symptoms. They just might not have had some big diagnosis put on their record somewhere. So they're still included in that category. And over time, we have seen those ranges widen and shift to some extent as we live in a country where we're fairly toxic. We have, unfortunately, a lot of environmental toxins coming in, water, air, food, right? It's a challenge on us. We're also stressed. We're not sleeping as well as we should be. There is bad food easily available for everybody. So some of these averages, we go, okay, do we really want to be average or do we want to be healthy? And functional medicine started taking some big steps to say, what does an actual healthy person look like? So we do use some different reference ranges. We often have a little bit narrower scope, and sometimes we even shift those reference ranges altogether based on, again, how healthy we're looking at a person and how good we really want people to feel. So that's one of the big things with those tests that we look at differently. We have a different set of reference ranges. Patterns. So we get trained, and that's what we work on a lot, is figuring out these little puzzle pieces with patients. We don't want to look at each marker individually and go, you're in my range, you're out of my range. We're going to look at these different patterns and say, oh, you know what? You're in range, but man, everything is at the bare minimum of what we really wanted to see. Maybe we should start stepping in and looking a little bit more in depth now rather than waiting for things to keep getting worse and finally for those ranges to get out of where they're supposed to go. Or for another example, we have some markers that are supposed to move together. So when one marker is really high and another one is really low, something is going on there. So they might be in range, but the pattern is incorrect. And so we're going to look at that too and go, okay, something is happening here. Let's look at this a little bit more in depth too. And then the third piece of that is the systems piece. We're not looking and going, oh, this just applies to your heart health. This just applies to your gut health. This just is inflammation. We're always trying to put those pieces together as a whole body and testing the whole body, not just certain systems of the body. So again, a lot of times we use the same labs that everybody else does. It's just looking at them differently.
Right.
Now, that being said, we do tend to go more in depth with some of our blood panels. And we do have more advanced labs, which we'll be talking about today, that aren't widely used Western medicine because insurance hasn't picked them up yet. So that's usually the reason that we're able to incorporate some of these other labs into our practice is insurance can be 30, 40, 50 years once a lab comes out before they incorporate it and allow it to be used and covered by insurance. Which great. We love testing. We love having this long-term stuff. But if we have something fantastic, 10 years in, everything's lining up and we're saying we're getting really great results with these patients, it would be nice if we were able to start utilizing that.
And you're right. Do you want to be the average American when it comes to testing? And do you want to fall in that range? And the range is just so large. And everyone, you've seen it you're like, I can be at like a 5 all the way to like a 25. And there's just, so it's good to know that you guys are looking at things just a lot differently and you're interpreting it as well. So.
One of the big ones is iron, because at least, especially women tend to be a little bit more familiar sometimes with those iron patterns. There's one in there, iron saturation percentage, that can be 15% to 60% typically on normal lab ranges, which is, that covers half the spectrum.
Yeah.
You're like, no, this isn't where this number is supposed to be. So it is always shocking how wide some of those reference ranges get sometimes.
Well, I'm sure we could probably do a whole entire podcast episode on this, but for today's episode, we're talking about functional medicine testing. So let's go into the first one that we wanted to cover, which was continuous glucose monitoring. Why would someone who doesn't have diabetes care about their blood sugar patterns?
Yes. So blood sugar and insulin. So blood sugar is kind of our glucose throughout the day. So glucose is the sugar that's inside our bloodstream and it going up and down throughout the day. And insulin is the hormone that controls blood sugar. And for two reasons, everybody should care a ton about their blood sugar. One is blood sugar dysregulation. It doesn't even have to be just high or low. We have so many patients that spend the entire day doing this giant roller coaster of blood sugar. That is hard on the body. That is a lot of energy wasted for the body to try to keep bringing it back to a normal midline that could be spent elsewhere, healing other tissues, helping get other junk out of the system. So when we have blood sugar dysregulation and we're not keeping it this nice stable average, we're spending way too much energy trying to do other things. A lot of just chronic not feeling well, sleep, headaches, sometimes even digestive issues. Mood is a big one. Weight, a piece of that. Even if we don't have diabetes, that blood sugar going up and down, that's going to affect all aspects of our life. And same thing with the insulin. The higher those blood sugar levels are, even if it's not considered diabetes. But the higher they are, or the more dysregulated they are, the more likely our insulin is to increase as well. And insulin is my whole body communicator hormone. It is the one that helps the brain talk to every single other hormone in the system. So if insulin isn't in the correct range, none of those other hormones are going to be either. And that's why blood sugar is one of the first things that we really work on with a lot of patients, because once we can get it regulated, that's a giant step right there, no matter what symptoms patients are having. If we can fix that blood sugar and that insulin, a lot of other things are going to start falling into place.
Well, I've noticed even for myself, just even sleeping, like if you're waking up in the middle of the night, energy levels. So you're right. Blood sugar does control most of our day
Yes.
and how we're showing up. So
Yes.
different than just approaching it as like I'm hangry or understanding it in a different light. So it's really just how our body's functioning and how it's using our fuel throughout the day.
And before, we used to have, obviously, glucose testing. We had the glucose finger pricks and stuff like that. And a lot of patients are familiar with hemoglobin A1C as a test as well. So that's usually what they would go in and get tested, is glucose and hemoglobin A1C. Glucose is a spot shot. If you eat a candy bar, it's going to go up really quickly. If you don't eat for a few hours, it's going to start going down. So it's nice to see, but it's kind of a spot shot of right then and there. It doesn't give us this whole story. Hemoglobin A1C, which that's where we have our diagnoses for pre-diabetic and diabetic, but it's also not a great marker. Hemoglobin A1C is an equation, and it is an equation of how much blood sugar you have and how long do your red blood cells live. And we don't know half of the equation. We don't know how long your red blood cells live. That is a crazy test. It's very expensive. People pretty much never do that. So hemoglobin A1C, if your red blood cells are only living at the low end 2 months, they might not be as exposed to as much blood sugar as somebody whose red blood cells are really healthy living to 4 months. So those two people can have a very similar looking hemoglobin A1C number, but the person who lives to 4 months is going to really technically have less blood sugar exposure over time. They're going to typically be healthier, but they look the same with that hemoglobin A1C. So we have some patients that should be marked diabetic, but their hemoglobin A1C looks better because they have really unhealthy red blood cells that aren't living very long. And we have really healthy people that are sometimes put in that pre-diabetic stage, no matter what they do, no matter how little sugar they eat, because their red blood cells are living really long. They're getting some sugar in all the time. They're just on that really far end of that scale over there. And that's why I love insulin, is using that insulin marker as well to actually look at that, because that's the hormone that's not going to lie. It's the test that's not going to lie to us. It's going to say, yeah, we're down here to a nice low 2 to 7 range where we're supposed to be, or above 25. Nobody's going to feel good up there. And I have plenty of patients that come into me over 20 on their insulin that their hemoglobin A1C looks perfectly normal.
What are some things so a continuous glucose monitor, actually, let's first describe that. Can you share what that is to our listeners?
Yeah, so a continuous glucose monitor. I love these. I'm so happy that we have them more available now. They are, instead of doing that finger prick and sometimes having to do that finger prick multiple times throughout the day, we attach a little sensor, usually to the back of your arm. There's other places you can attach it, but usually it's the back of your arm. And then every 15 minutes, it's going to send information to your phone. You're going to get this nice little graph for about 2 weeks long. So then for a whole 2 weeks, you get every 15 minutes seeing what that blood sugar is doing. That is so powerful. We get to see, how is your body reacting to foods when you eat? How is it reacting if you don't eat for a while? What foods are causing your blood sugar to spike more? What happens if you didn't sleep much the night before? We're super stressed to your blood sugar the next day. So it's such a powerful tool. And they used to be prescription and super expensive, and they aren't anymore. They're now over the counter and way, way more affordable.
Roughly how much are they?
Yeah, about $45 to $55 typically, for that 2-week time period.
Okay. And you can shower with it?
Yes.
Like
Yep.
Okay.
Yeah, they usually have 2 different take things over them. So you can shower, you can go swimming, you can go in your hot tub. I mean, it doesn't really matter. You can do all of that with them on.
And do you encourage your patients to kind of do a journal throughout that time period that they have it on, just so they know, maybe that night I didn't eat the best because we went out with family, or didn't sleep that good that night because I was working late on something for work, just things like that.
Right. They're always going to be helpful. So even if you don't have a food journal while doing it, it's still usually going to provide a lot of information for us. But combining it with what food you're eating is extremely helpful. Then we get to dive into the details of like, oh, look at exactly what happened when we ate this food. We did it 3 times. Every single time your blood sugar spiked to 200. Okay, we have a really good example of what that issue was. And a lot of the continuous glucose monitors out there, the apps that are included with them, usually have a place to put all that food tracking with each day. So you can just look at all that information very easily together.
Okay. Even just like fruit, for example, like
Yeah.
maybe
Yep.
you're sensitive to one certain type of fruit, even though you
Yep.
love it and it is a fruit and it's healthy, but maybe because you do know that it spikes so
Right.
high that you
Yep.
only consume it every once in a while or something like that.
And we have, bananas are the big one. Lots of patients that love bananas. It is my least favorite fruit. We've just bred it for so long to basically be a dessert. Now
Mhm.
it's very sugary, very low nutrients, lower fiber now. So it is always interesting because some of these fruits, even, eating them on the blood or glucose monitors, we're seeing it skyrocket. Not every patient, but there's a lot of patients out there that are eating something like a banana, and that's the only thing they're consuming, and their blood sugar is going up like crazy. And so
Mhm.
we get to again monitor which foods are causing an issue and which ones are not.
Right. Well, and we could do like I said, there's so many things we could just sidetrack, but it's like,
Mhm.
okay, so what do you pair then with a banana? Like
Right. Yeah.
pair it with some peanut butter so that
Yes.
you're like
Yep.
the
And it's
blood.
another usually when I have patients go do continued CGM testing, and I'll call them CGMs from now on, they're just a short order, but we usually set the range from 70 to 140 and kind of watch to say, okay, if you go out of that range, especially make sure that you are doing something. The first week, eat as you normally would. So eat just normal. Let's get a good baseline for everything. And that second week, experiment, right? That's where we start saying, okay, eat something just carbs or just sugar wise and see what happens. Now put that exact same thing as you were saying with some nut butter, with some protein, some fat. What happens then? Because that banana often spikes people way more than potentially like a chocolate brownie does,
Mhm.
because that has egg, that has oil in it, that has these other things in it that are going to help minimize that glucose spike reaction.
Right. Wow. You don't think about it like that,
No,
but yeah,
mm-mm.
brownie would maybe not spike as
Yep,
much because it has all
yep.
those things in it.
A
Crazy.
really sugary brownie, maybe, but
Mhm.
um, but if they're not too bad, then sometimes they don't really spike that much on the glucose scale.
Mhm. Especially if you've eaten, like, ahead of time, like,
Right.
that's, like, the
Yes.
last part that you're
Right.
eating if
Yep.
you want.
Exactly. Exactly.
So what would you say are some of the most common surprises that people see when they wear a CGM for the first time?
Yeah, so with the most common surprises, we kind of talked a little bit about it already, but I
Mhm.
think the biggest one is how perceived healthy foods affect their blood sugar. Fruits are one of the big ones that we get a lot of surprises from patients back on. Oatmeal in the morning is
Mhm.
cereals in the morning. Those are huge. Some of these breakfast foods are probably where we get some of the most surprises of how much that blood sugar is going up. And vice versa, they are sometimes eating things that they would perceive as unhealthy, like potentially that brownie that
Mhm.
isn't spiking their blood sugar nearly as much, because it is how stable are we already at with that blood sugar piece throughout the day. And then stress and sleep. That's the other big one. We've had patients come back and be like, it was amazing how much more my blood sugar increased the next day when I only slept 4 hours that night. It was amazing when I had a huge stressful event the day before, how much higher my blood sugar was up the next day because of that stressful event. So, our sleep, our stress, not just food, also affects how we respond to blood sugar.
Why is that? Why would lack of sleep or stress impact?
Right? And it is a whole body system, right? Cortisol is one of the big players with all of this. Cortisol, patients think of it as our stress hormone. I call it our firefighter hormone. It's there to put mental or physical fires out from us. But lack of sleep is a big is a big physical fire, and something stressful event with us is a big mental fire. Cortisol is going to come out to play. Cortisol breaks down glycogen into blood glucose so that we can respond to things better, right? It's running from that tiger. So that's what our
Mhm.
body's meant to do. If we think, oh my goodness, something is chasing me, I've got to get away, start chucking out cortisol so that I can respond appropriately.
Mhm.
Unfortunately, in today's day and world, we don't really have actual tigers after us, right? But that one work email, that family member saying that one thing, that little bit of not getting enough sleep because you were ruminating for 2 or 3 hours that night can feel like a tiger to our system. So it's going to do what it thinks it's supposed to do.
I'm just about to take a drink of water and I was thinking, does
Yeah.
water impact blood sugar? since it's like there's no component to it, but does it if you're hydrated or not?
And I was going to say, it's more that hydration piece, because the more hydrated we are, the more properly we work, right? When we are getting things out of our digestive tracts more quickly that shouldn't necessarily be there, we're keeping fibers in more, and absorbing and sponging up some of those extra sugars in the system there. So being more hydrated is absolutely going to help control that blood sugar. Honestly, one of the biggest ways though that it does is when we are hydrated, patients feel more full. So we just feel more full in general, and we don't really think about it or consider that. But patients that do a great job drinking water, keeping up with their water intake as they should be, typically don't have quite as many cravings, and they're not as hungry throughout the day. So they aren't, increasing that blood sugar the food way either.
Okay, that makes sense.
Mhm.
I want to trace back just a little bit because we were talking about breakfast not too long ago and the
Mhm.
importance of kind of like setting your tone for the day.
Yes.
So how important is breakfast for everyone, but especially for women when it comes to blood sugar and hormones?
Yeah, yep. So love this question too. So when we wake up in the morning, right, that's kind of where our blood sugar is lowest for the day. That's supposed to be when it's mostly lowest. Whatever we do next is going to set how our blood sugar roller coaster goes the rest of the day. If we eat something with carbs, sugars, even starch for some patients, and fruits, of course, we often see that blood sugar go spike up. And now we're kind of already on this roller coaster. We've set that roller coaster to do this throughout the whole day. If when we wake up, we choose something that's going to really modulate or keep that blood sugar right at that nice middle level, like fats, proteins, vegetable fibers, those are the three that we really encourage at the office here. Now, even if they have something not as great in the middle of the day, it's going to blip. It's not going to spike. They already have this nice modulated line that's going to help absorb and reduce any other blood sugar spikes in the middle of the day. And for women especially, so this is always fun information because we used to do, and we still mostly do, all of our health research on men. They don't have these pesky hormones getting in the way that are going to cause weird things happening to the research. We are finally starting to do more research on women, and we are different. The amount of estrogen, progesterone in our system forces us to be different and react differently to things. Intermittent fasting, especially, is the big one I get asked about all the time. Men do fantastic having an intermittent fasting window when they're like, I'm going to eat from 12 to 6. That's it for the day. That's what it's going to be. And I'm not going to have any cravings. I'm not going to get moody when I don't do this. I'm going to lose a bunch of weight when I'm doing this. And it just seems to work so easily for men. And when women try it, they tend to get so frustrated. They're like, this isn't working. I'm craving stuff. I am hangry all the time. I'm not losing, maybe I'm losing a little bit of weight, but nothing like my husband is doing. And I am giving it my all. And that's because intermittent fasting doesn't work the same way for women as it does for men. We have, again, the estrogen, progesterone. It's supposed to start off in the morning, and those levels change throughout the day too, not just throughout the month. So they are already changing daily, not just day to day, but hour to hour for the most part. When women eat first thing in the morning, we are turning on our metabolism because we're affecting that estrogen and progesterone, which then helps affect our insulin and cortisol in good ways. It kind of puts this whole hormone machine, turns it up, starts it running, so it does the things that we're supposed to do. It helps increase our brain function, our energy for the day, keeps our mood steady for the day. So we get all these nice things when we do turn that machine on, as long as we're giving that machine the right fuel to turn on. So we do intermittent fasting a little bit differently with women. We tend to have women eat a bigger breakfast, fast through the middle of the day, eat a nice dinner so that they can eat with their family and everything as well, and then have another secondary fast throughout that nighttime. When we fast, we are not only giving our digestive tract a break so that it can heal, we are turning on a whole bunch of different cellular repair mechanisms and teaching our body to draw from our big fat battery rather than just our glucose battery. And our fat battery burns cleaner. It's like the clean gas for the car for the most part. So we want to grab from that more. So over time, that gets easier and easier. And a lot of women do really good on this type of intermittent fasting because we're having 2 intermittent fasts throughout the day. We're teaching our body to reset those hormones to grab from that fat battery a lot more quickly than if we just had 1 fast a day.
At what point do you encourage people to break their fast in the morning, specifically women, I guess?
Yeah, so usually, and this is, and I should put this in here as well, this is very individualized. Not every woman comes into the office ready to do this, breakfast and dinner to dinner fasting piece or anything like that. And for some women, we might never get there. There are going to be some different pieces out there that I might say you are just not meant for this type of fasting, or at least it's going to be a year or two before we get that. But for a lot of women, one of the things is we're saying within an hour or two of waking up, we want to see you start having a good, healthy breakfast that's going to set you up well for the rest of the day. We also tend to make people eat more than they think they should in the morning. Because if you don't eat enough in the morning, you're going to get hungry. You're going to not make it to that dinner time piece. But a lot of that is, again, filling up more on vegetables, filling up on good fats, good proteins in the morning. And patients are shocked at how long they can go before they start feeling hungry or the need to eat or anything like that.
Okay. No, I had a listener say not too long ago, she was like, I actually eat a salad in the morning too,
Yeah.
just to like get the greens in there and start the day
Yep.
off. I mean, I do a lot of greens when I have eggs and things like that
Yeah,
too.
I have a lot of patients that have gone towards salads in the morning. Soups in the morning is a really big one. They just make like a vegetable chicken soup or something, and they heat that up, and that works for them. So I just always remind people, breakfast, especially in America, breakfast doesn't have to be what our supposed breakfast foods are, right? It's just another meal. Whatever you like eating, you can eat that in the morning if it fits into our kind of parameters for what we want you to be eating in the morning.
Right. Well, and thanks again for pointing out that like every human being is different. So figure out what works for you, and when your body is in this like nice, lean,
Right.
what do you say, kind of mode, but to be
Yeah.
able to like burn fat and do all the things, but
Right.
get curious about what that looks like for your body specifically.
Right.
So hormones are a huge focus right now, and they all work together in complex ways, which you were hinting at earlier. How does the Dutch test give a deeper and more complex or complete picture compared to traditional hormone testing?
So there's a few different ways we can test hormone. Blood is our more traditional way, I want to say. Saliva, so spit is another one, and urine is another big one. And when we use, especially when we're putting blood and urine together, we're getting a bigger, fuller picture of everything, but they are testing different things. So with hormones, sex hormones especially, so they're steroid hormones, so they're a little bit different than some things like our thyroid hormones. But that's, our typical estrogen, cortisol, progesterone, androgens like testosterone. When we test them in the bloodstream, what we are testing for is what is sitting in the bloodstream right now waiting to get utilized. Unfortunately, with a lot of the literature and research, it doesn't show that it matches up with patient symptoms, and it doesn't show that it matches up with patients' treatments. It's one of the reasons that insurance companies are less and less allowing hormones to even be tested. Patients are having to do a lot of pushback to sometimes get hormones tested. When we test in urine, rather than just seeing what's sitting around in the bloodstream, what we get to see is what of that hormone actually got to the cell. How did the cell use that hormone? And when it was on its way out of the body, did it exit safely, or did it get stuck somewhere, becoming a more inflammatory, destructive molecule that we want to start changing those patterns around? So with the Dutch test, because it is a urine test, that's the bigger picture we get to see is what's the body actually doing with this hormone? What's of this hormone is getting to cells, to the body at a cellular level, and how are we actually utilizing it? And our body, basically our hormone body, we've got this whole river that starts at cholesterol, which is why cholesterol is so important when it comes to hormones as well. So it starts with cholesterol, goes down into pregnenolone, DHEA, and progesterone, and then that DHEA turns into our androgens like testosterone, which turns into our estrogens. And the Dutch test shows this whole big river coming down and these different little tributaries, little offshoots that go out as well. And if certain numbers are really building up on one side and they're really low on the other side, we're going, oh, this is a big mismatch. We're seeing that your body isn't utilizing these hormones or pushing these hormones down the right part of the river.
Okay. So if I'm understanding everything correctly, it's like it starts at the river and then it gets kind of used up. So by the time that it's ready to exit the body in the urine, based on that composition, how efficiently things are working.
Right. Yep. Exactly.
Okay.
Exactly. Yep. We can see all those end range pieces there that then show us like how much of it turned into this hormone, how much of it turned into this hormone. So we're looking at all those end range metabolites that are coming out of the system.
Okay. That's really interesting. So how does the blood test differ than the urine test? So the blood test only can tell you what it was at a certain point in time?
It can tell you what's in the bloodstream, right? But what's in the bloodstream doesn't equate to what's getting to a cell. That's what's moving around the bloodstream. So that's always the interesting part because we can sometimes see people have high levels of hormones or low levels of hormones in the bloodstream, and it doesn't match up with the cellular, like that urine output of what's actually going on in the body. So that's where the big disparity is yes, we can see what's in the bloodstream, and sometimes I will go, sometimes it's nice to see what's in the bloodstream. That's part of the picture is to say, okay, you have really low output of all of these hormones on the urine test. What's going on? Let's see in the bloodstream. Is this normal? Is it high? Is it also low? Where is this the start of the river also kind of coming down into a little bit as well. So we
Okay.
don't always start with the blood, just depending on cost wise to some extent. We typically start with the urine testing, but if there's some really, really weird issues going on in the Dutch test, we often combine blood markers with that just to get that even a little bit bigger picture of everything going on.
Okay. So who is the ideal candidate then for deeper hormone testing like that? Even if you're showing like, my hormones the last time I was in, they were normal, but I'm not feeling great.
Yep. So hormones affect everything in our system, right? I mean, they affect every single thing. They intertwine with everything else we've got going on. Our insulin, our blood sugar, our cortisol, our stress hormone, right? What is our thyroid doing? They affect our digestion, how well we're sleeping, what is our mood for the day? How well do we do tissue repair? So in my opinion, I mean, everybody is the ideal candidate for getting hormones tested, and especially the Dutch way, which I'll go into in a second here because it tests more than just hormones. But for the most part, everybody's an ideal candidate. That being said, the people that we're especially looking at that hormone level wise, we really want to be able to help is patients with bad periods. So if they're having bad periods, we say, okay, let's get a look at what's actually going on during this time. What are these hormone levels? Is this a hormonal issue? Is this more of an inflammatory issue or nutrient deficiency issue? So we get to start seeing that piece of the picture. PCOS, endometriosis, of course, we're always going to be looking at what these hormones are doing too. Anybody with potential estrogen cancers in their family, we like to run this test because that's some of those breakdown products that get very inflammatory and destructive. So we watch for that too to make sure that everything's going down the clean pathways, not into the destructive high-risk estrogen pathways that might push you over to that direction too. And of course, we work with men all the time too. So if they're, having lower energy, lower libido, feel like they're not, muscle tissue health isn't where they want it to be, we're always looking at that hormone level with them too.
Okay. I was curious. Yeah. Does that apply to men as well?
Yep, absolutely. For women, even when they're not having issues, honestly, I say it's worth getting that Dutch test done every 3 to 5 years for the most part, just to keep watching what everything is doing. Men, we tend to put out a little bit further to say somewhere between 4 to 8 years is redoing that. And the reason, more so even than just the hormones, because I really like this test for the hormones, but I love this test because I call this my garbage truck test. We have all these different garbage trucks, that go around the town, right? Different routes. They pick up garbage, bring it out. They keep our town clean, functioning the way that it's supposed to be. We have a bunch of garbage trucks in us as well that are supposed to go around and grab junk, typically again at this more cellular level, so that we're taking them out of the system too. Glucuronidation, methylation, hydroxylation, sulfation, all these Asians are these garbage trucks that pull things from our body. And I think the Dutch test does a pretty decent job at showing which of these garbage trucks are turned on nicely, which of these garbage trucks have not left the station, and they are not helping clean your body out. Our chronic issues tend to often come more from us not being able to clean up our system. So these garbage trucks are important to everybody, how we're functioning. We want to make sure, again, especially since we're in a little bit more toxic environment nowadays, that we've got these garbage trucks on, running, doing the best that they can, because the cleaner our system is. Have you ever seen the show Hoarders? Yeah. So I always kind of compare it to that is we don't want hoarder cells. We want those cells to be clean, to be functioning. We don't want them filled with junk that cell is being like, I have to figure out where to go to make the building blocks for this protein before sending out the cell. No, we want you to easily be able to do your job and function. So that garbage truck piece is important to everybody.
No, it's a great visual.
Yeah.
And we live in our body hopefully for 80 plus years. So it's like
Mhm.
we want to know and that our body is working efficiently and taking
Right.
care of it. So
Yep. Yep. And one of the other things, just to touch on that, because it's such a big issue with most patients, is the testosterone piece. Because I
mhm.
can't tell you how many patients come in, women and men, getting placed on testosterone, feeling really good for a few months to maybe even a year, and then everything kind of starts hitting this turning point where they're like, it's not working as well as it should have. It's
Mm,
I started getting more symptoms. Other things started making a turnaround.
mhm,
And I think the Dutch test is really helpful at showing too which hormones, if we're going to go on hormone replacement therapy, which hormones are safe for me. That's always our first big question, is which ones are safe, and then which ones are actually going to be effective. Because talking about that hormone river again, testosterone fairly easily in a lot of patients turns into estrogen. So people
mhm,
can be low in testosterone, because their river is so strongly pushing right and flowing right into the estrogens. It's got rapids going over into this estrogen piece. So they don't feel well necessarily because they are low on the androgens to some extent, but then
mhm,
they're high in estrogens as well, which can cause mood changes, weight gain, not sleeping well, brain fog, brain fatigue, all this kind of stuff when we have too much estrogen in the system. And then when patients get placed on testosterone, it is a type of steroid. So people tend to feel really good for a few months on it. But if that testosterone is just turning into estrogen down the road, in the long run, they're just going to have more and more estrogen in their system. So
mhm.
it's just, again, really helpful for a lot of people to actually see what does their hormone river look like and where do we start changing that.
Right. So what's the answer to stop taking testosterone so it doesn't convert to estrogen or reducing your dose? What does that look
Yeah, so this is the fun thing that we get to talk about in functional medicine.
like?
Because every patient again is going to be different and want to go down a different avenue sometimes. So we talk them through with them with all the different options available to them. One of the bigger ones we tend to go to is how do we stop the river from turning
Mhm,
everything into an estrogen? Because there's a lot of change we can make along that river. So very rarely do we change or talk to people about changing their hormone replacement therapy immediately. We first work for a few months on changing the course of the river. Aromatase is the enzyme that turns androgens into estrogens in our system. Two
mhm,
of the biggest things that increase that enzyme, make it work stronger, so we're turning more of those androgens into estrogens, is inflammation and blood sugar dysregulation. So a lot of times we're already working on that. And if we can get blood sugar better and calm down inflammation in the system, that aromatase enzyme is going to be like, oh, okay, I can let
mhm.
things stay in the androgen section more. I don't have to turn everything into estrogens. And once we start changing that river, it's also easier to have more discussions about what should we do with that hormone replacement therapy part now as well.
Okay. No, that's good to know. And how often do you recommend getting these levels tested?
Yeah, so when we're in the middle of this, when we're having hormone issues or we're really trying to figure out the exact right hormone replacement therapy stuff and everything too, usually every 6 to 12 months is what we're doing, closer to probably that 9 to 12-month time frame. If someone's having major issues, we'll go for that 6-month time frame, but it's usually once a year until we start going, okay, these levels are really normalizing out. We're seeing a much prettier picture, and usually that takes 2 or 3 years before we get to that really nice balanced hormone picture that we start saying,
Mhm.
okay, we're going to start spacing out this testing. It's going to go to every 2 years, every 3 years, every 4 years, whatever that might be.
Okay. That gives people perspective too, because you don't
Mhm.
just change your health overnight. And
No,
I think we're all
unfortunately, we
realizing
don't.
that there's
Yeah.
not really quick fixes,
Yep.
if you want
Mhm.
a strong, stable health,
Yeah.
for the
Yep.
rest of your life.
We spent a really long time typically getting our bodies into this state, whether we felt it or not. It takes some time to unwind. I always use the bathtub analogy. We have our bathtub, we have our faucet or sink coming in, and then we have the drain at the bottom there.
Mhm.
And until that bathtub is overflowing, we don't feel a ton of symptoms. But that bathtub, we want that bathtub water to be nice and low. We don't want it to always be right at the threshold, right?
Mhm.
That all of a sudden it's just starting to overflow and we're like, what caused these symptoms today? I don't know. I can't figure it out. But it's
Mhm.
usually this whole mixture of different things coming in from the faucet, depending on the day. And are your drains operating as fully and good as they should to keep getting that water out?
Mhm.
But if your bathtub's full, it's going to take a little bit of time to start getting that bath water out. And that's always what we hope to build too, is more resilience with patients. Because if we can keep that bath water nice and low, you can have a stressful month, and go build that bath water halfway up. You can go on a week and a half vacation, eat weird, drink a bunch of stuff, right? And build that bath water up a little without it overflowing. So that's always that big goal there too.
So the next test that we wanted to talk about when it comes to functional medicine was food sensitivity testing. And I loved how the Dutch test and even the blood glucose monitoring testing, they kind of go hand in hand, right? Like you were saying, like it's actually probably good to do both so you understand kind of how all the systems are working together. But food sensitivity tests, they can be confusing. Can you clearly explain the difference between a true food allergy and a food sensitivity? And why they're tested differently?
So with food allergies and food sensitivities, they get confused all the time because, the majority of the population doesn't know the difference. And I think that's okay. But allergies are a very specific part of our immune system, the IgE part of our immune system. And sensitivities are a different part of the immune system, IgG part of the immune system. So the E part tends to be the more typical allergies that we think about, runny nose, red eyes, sneezing, anaphylaxis to some extent. So those are kind of typically what we see a little bit more with that E piece. We can see some other pieces there, but that's the more common stuff. G tends to be more chronic. So this is more of our chronic immune system reaction. So with the IgG sensitivities, we don't see necessarily this quick reaction that we get with that E part of our immune system. With the G, it's often a slower time coming on, and then it can run at this low or high grade for a really long time. And that's where we tend to see more things where it's not just the digestive stuff, because a lot of people too are like, well, I don't have digestive issues. Why would I have a food sensitivity? But when that G part of our system gets stimulated, that's the thing that can cause a lot of skin issues, a lot of sleep issues, anxiety, depression that we see a lot with patients. Headaches, migraines are a huge one with that. Even allergies to some extent. If that G system is increased, it's going to make you more likely to have your other parts of your immune system overstimulated. So, so that is the difference. The E part, can be more severe because we've got that anaphylactic piece. There's rarely going to be that severe of a reaction to G, but G can be horrible. It can cause, people in bed for days, major nerve pain, migraines for multiple days on end. So we don't want to understate the importance of, the reaction to an IgG or a food sensitivity, but they are different pieces of that immune system reacting.
Okay. So you have the external or things that are going to be causing inflammation, and then you have the things that you're consuming. So a lot of people try the elimination when it comes to what you're actually consuming, so the elimination diets on their own. Do you believe that elimination diets are helpful for everyone?
I think elimination diets, when done correctly, are extremely helpful. It's just really hard to do them correctly. We actually still utilize it when we do food sensitivity testing. We just get to minimize it more. So elimination diets, that's taking out like everything, right? And then very slowly, week by week or month by month, adding things in. They can take forever, and it can get very confusing of what food actually caused an issue or a reaction in your system. And we've tended to see that people don't pretty much almost never do them correctly. So we don't really get the answers we want from them because of how long it takes to actually get good answers from it. We often see fear of foods develop when there shouldn't be a fear of food there. We see some different eating, potentially different eating disorders start developing around these fear of foods. So we're very cautious about really utilizing just elimination diets. And it's just stressful. It's just stressful to have to keep thinking every day, like, what can I eat? What can't I eat? And when do I add the next piece into that? So with the food sensitivity testing, we're often narrowing it down to a much smaller amount of foods. We get to see not only what is your immune system reacting to, how big is that reaction? So the one we use in the office is from Mosaic Diagnostics. It's their food map. And they have 5 different levels. So you can have no reaction, low, moderate, high, very high. So then we also get to have a discussion to say, which categories do we want to start taking out? Which ones do we want to start working with? And are you, as the patient, okay with this? Can we keep up with any of this when it comes to that? And so oftentimes for patients, when we're using the food sensitivity tests, we're doing a little bit of the elimination piece, but now we have 1 to like 20 foods that we're playing around with, not the entire breadth of food that
Mhm.
exists in the world. So it really helps manage what that actually looks like.
Okay. I know, I was even thinking about how do you do this, like, with children,
Yeah.
how
Mhm.
stressful is that to
Yep.
be like, "And we're not eating any of this," and
Right.
controlling it at school and all the things, so,
Yeah. Yeah.
um
And that kind of comes back to that too, because even with the kid piece, like you said, depending on how much people come back positive with, will also change what we end up taking out. Because if someone comes back with like 5 things overall positive, we'll probably have a talk and be like, "How do you feel about removing these 5 things for 2 to 3 months?" It's affecting something, a little bit, but not a ton. Let's go for it. If people are coming back with 50 things positive, we're gonna have a discussion. I'm not gonna expect you to take 50 things out of, your food diet unless you're really gung-ho about it. But for the most part, I'm going to say let's narrow down these categories and start differently with this piece.
Mhm. Are there certain categories that just naturally will cause higher levels, or does it kind of vary person to person?
I don't know if it's categories or families of food so much, but there are foods within those categories that we sometimes see irritate people more. So if they come up positive, we will point out and I'll go, this one is one that if we take out, we often see a lot of patients improve and change differently. I mean, gluten is one of those that for most people, if they're coming up slightly positive on that one, taking it out, patients typically always feel better removing it.
Mhm.
Tomatoes is another one. Tomatoes is a big one too, that if they're coming up at all positive, sometimes we're just removing it from the system because we get bigger changes when we take that out.
Okay. I know I don't know if it's true, but I've heard that everyone has a little bit of gluten sensitivity.
Mhm.
It's just a higher inflammatory,
Right. Yes.
kind of,
Mhm.
um, component, but
Yes. Yep. Yep. Nope. And I agree with that. Everybody does have some gluten sensitivity. We're just eating it in a lot larger amounts than we used to, and we're
Mhm,
not pairing it as well with other things.
mhm.
And that's causing us to have way more reactions than we used to in the past to it.
How might food sensitivities reflect the health of someone's gut, or you call it the intestinal wall breakdown?
Yeah. So with the gut health, again, that kind of comes back to how many things come back positive. So that it gives us a really good insight to how healthy is that wall gut. So our intestines, it's actually outside of our body. I know a lot of people don't look like it, think about it that way, but we're kind of a donut hole. So that intestines is that middle of that donut hole. It's not really supposed to be inside us. Those things that we're putting through there aren't all supposed to get into our bloodstream. And we only have a 2 cell wall for the most part between that outside in our intestines there and the inside of our bloodstream. It's pretty thin, which is why we want to keep it as healthy and tight as possible. So only the very basic pieces, the amino acids, the vitamins or minerals are getting its way through that wall, not these bigger proteins that are going to cause an immune reaction. And when someone comes and does that test and they have, 1 or 2 things in like that severe category, 1 or 2 things in the really high category, a few things in moderate, we go, okay, you probably have a fairly healthy gut wall. Not a lot is coming back positive, and we have some really good key things that you probably just have an immune system sensitivity to. But when people come back with 30, 40, 50 plus things in those first top 2 levels, I'm not going, oh, yeah, you're totally sensitive to all of these. You're never going to be able to eat, any of these ever again in your life. I'm
Mhm.
going, no, I think we really want to focus on the integrity of those cells right there. We need to make them healthier. We need to make them tighter so that they're not letting the wrong things through, because it's that inflammatory stuff going through our intestines, the big proteins going through our intestines that tend to cause inflammation, chronic illness, and other issues that patients tend to have. So it kind of changes, depending on how much you come back positive, changes how we work moving forward from that too.
Okay. No, our gut is very important. They say it's our
Very.
second brain,
Yes.
so
Mhm. Yep. Nope. Very important. There's nobody that comes into this office that we don't do some gut work with. That's just how important it is.
one of our listeners submitted a question, Elise. How accurate are food sensitivity panels? So I guess that's the first question. Maybe the
Yeah.
second question is, I react to gluten, but I do not have a celiac marker.
Right. So I'll start with all that there. So food sensitivity tests have come a long way. I would say even in the last 5 years, there's been some new technology that they're adding in more that's made them much, much better for the most part. Because I used to be wary of them too. I wasn't getting the results from patients that I wanted. And we're really starting to see that when we take out these key foods, we are getting those changes or results for most patients. I'm much happier with our food testing now than I was like 15, 20 years ago for sure. The celiac piece, right? Because that's what happened was she didn't come back celiac, but is still reacting to gluten. Celiac in of itself is its genetic change in some patient systems that cause them to become severely reactive to gliadin A, which is one specific type of gluten. And I think we've identified now gliadin A. I think it goes to G now, maybe even H, gliadin H down the road. So there's all these other gliadins in there, that are basically glutens that we can still have these reactions to. And you can still have a reaction to gliadin A without having that genetic component that makes this severe reaction in the system happen. So we have patients all the time that don't have those genetic markers, but know that they take gluten out of the system, they are doing way better. So I don't think, not having that genetic marker, but still having that gluten reaction doesn't make food sensitivity tests bad. It's just what are we, understanding more, what are we actually testing when we're doing that?
Mhm.
The other piece with food sensitivity testing that sometimes trips people up is that it is testing your immune system reaction to a food. Is your immune system lighting up and trying to attack these proteins that are coming in against this food? What it's not always testing is some other inflammatory pathways that can cause, the glucose potential reaction to it, and just having that in of itself. If there's a sugar in the food that your digestive tract or bacteria is having trouble breaking down, you might notice more gut reaction, but you might not have it come up on that food sensitivity test. So that can cause a little bit of an issue as well. Dairy is one of the biggest known ones because lactose. You might not have an immune system reaction to dairy, but if you can't break down lactose, you're still going to have issues digesting it. So there's a few other things too that come into the mixture there, but the food sensitivity tests do a pretty good job of at least helping us really narrow things down more.
Okay. Well, thank you for answering that listener question for us. And
Yeah.
of course, people can follow up too. So before we wrap up, I'd love for you to share, how can people work with you? What's new? What's exciting in your practice, especially with the launch of your new Firestone location?
Yeah, yep. So we are located right in Erie, right by Fitness 4040 and Aspen Ridge over here. And so we just love working with the community. We started in 2018. We've grown to having functional medicine, chiropractic, acupuncture, dry needling, massage. So we are able to have all these services under one roof. And as practitioners, we are able to talk to each other about certain patients too, so we can get the best care possible for patients. And it was exciting because it's been just over a year now, a year and I think 2 months since we opened our Firestone location. So we've now opened up that Firestone location as well. We are offering at the moment chiropractic and functional medicine over there. And we're looking to expand that over the next year or two into some of our other services as well. And if anyone's interested, they can email, call, text our office. We have a fantastic admin team. We've got 4 admins up there that just love helping and working with patients and answering whatever questions patients have.
I think one of the biggest takeaways from today is that you don't have to settle for feeling off without answers. There are tools available to help you better understand what's going on in your body and take a more personalized, proactive approach to your health. If this conversation sparked your interest, I encourage you to connect with Dr. Boldt and her team at Live Your Life Integrated Health and Chiropractic here in our community. And as always, if this episode was helpful, please share it with a friend, follow along, and leave a review. It truly helps us continue bringing these conversations to the Erie community. Thanks for being here, and we'll see you next time. Thanks, Dr. Boldt.
Yes, thank you so much for having me. It was so much fun.
All right, friends, before we wrap up, here's the part I need to share. This podcast is for educational and inspirational purposes only. I'm just your friend behind the mic. Nothing shared on this podcast creates a patient relationship with any of our guests or replaces the guidance of your physician, professional coach, or other qualified expert. And the views shared by guests are entirely their own and don't necessarily reflect the beliefs or values of the Erie Wellness Podcast. My goal is to simply create a space for real, open conversations that help us all learn, grow, and feel a little more connected on our wellness journeys. Thanks so much for listening. I'll see you back here next time. Thank you so much for listening to today's episode of the Erie Wellness Podcast. If something from this conversation resonated with you, I hope you'll take it with you into your week or share it with someone in our community who might need it. To subscribe, just head to the main page for the Erie Wellness Podcast, right where you're listening, and tap subscribe. And don't forget, when you start to feel better, you start showing up better in all areas of your life, and you deserve that.